And welcome back. We're continuing the news. To another primetime news follow-up now on policies to deal with special needs patients at public health institutions. Our reporter Jamaica Maitland looks at the gaps between what exists on paper and what actually happens at the hospitals.
Jamaica's Disabilities Act passed in 2014 but enacted almost a decade later in 2022 recognizes the rights of persons with disabilities to have quality access to healthcare services. Despite the legislation as well as the no user fee policy at public health facilities, the most vulnerable still face challenges.
Persons with special needs may have a more difficult time explaining themselves. They may have a more difficult time demanding service, as some people may do. And as a consequence, they may, which is not what ought to be not as tended to in some instances as they probably someone who is louder and will speak.
Merlene Allen, whose non-verbal child died at the Spanish Town Hospital in St. Catherine, is advocating for improvement for special need patients.
We miss, we lost a loving, a caring, an excellent child. Whenever my daughter and I'm going to the hospital, I'm going to see her again.
According to the CEO of the Spanish Town Hospital, Jaylene Hinds, the facility technically doesn't have a special needs policy. The provisions for the disabled at several other public health facilities also varied. Clinical coordinator at the Western Regional Health Authority, Dr. Delroy Free, explains what exists.
The truth is, we should be looking towards training, probably ward assistant type patients. And we have started some of that to some extent to help with these, individuals who are disabled.
Opposition spokesman on health, Dr. Alfred Dawes, says he's not surprised that there isn't an explicitly stated special needs policy because the principles of medicine does not change. The issue, he says, is with getting the patient's medical history and treating them after.
Our threshold for ordering investigations has to be lower, because you don't want to miss something because you can't get a proper history and physical exam. So it may mean you go to ultrasounds or CAT scans a lot earlier, and that means that you have to adjust your approach to the patient.
Ms. Allen believed things would have been different if doctors didn't wait more than 2 weeks before ordering an MRI on Jaylene. Dr. Dawes, a former senior medical officer in the public health system, says patients with special needs may react differently to pain compared to others. Environmental triggers like light, smells and scents, a new bed for example, could cause a disruptive response. Ms. Allen revealed that most of the visits to her daughter would be spent explaining to irate patients and some healthcare workers about Jaylene's condition.
Other patients on board were complaining that she don't sleep in the night, she's making a lot of noise at them head and them can't take it, better them come out of the hospital and whatever. And I was saying to them, this child is a special child, this is not how she behaves.
Dr. Dawes argued that being in the hospital may also disrupt the routine of special needs patients. In the United States, family members are allowed to stay with their loved one beyond the usual visiting hours to make them more comfortable. Jaylene's father, Paul Hinds.
In the morning, they're not letting in. We visit.
Mm-hmm. Even if it's you explain to them it's a special need.
Them not let you in. Even when she was on the ward, and if she could see her morning, it's a problem sometimes with the security because the rules are them set. You see, sometimes you have to explain to the Siki and say Siki X, Y, Z, and the Siki will say go on and stay along. I run, go up and run, come back down.
In part 3, we look at ways to improve the healthcare treatment of people with special needs, including the possibility of equipping healthcare workers with skills such as sign language. Jamaica Maitland, TVJ News.